So you are welcome once again to the Ministry of Health. So
take it seriously. We will need to put in the structures that can help the National Ambulance Service to become what it ought to be, so that we are able to draw closer to our mandate of achieving universal health coverage.
note, we welcome you once again. And so, without wasting
Madam Fanny Simpson asked for permission from Ghana National Fire Service. So thank you. Gani Michael Dimonso. Oh, okay. Thank you. I thought we were on the same flight. I saw you didn't see me.
I'm very observant.
But I didn't know you then. Well, that's okay. So you have two absentees. Chairman, one will finish the introduction and now inauguration. You will swear them in. At least you should know the name where you are working and, you know, some. Thank you.
Minister, former CEO of Ghana Cylinder Manufacturing Company, and now a board chairman
Of National Ambulance Service.
National Ambulance
Yet to
Service.
be.
A consultant in intensive care medicine and currently the acting CEO of the National Ambulance Service. I am Dr. Kwakunyame, and fellow emergency medicine faculty chair for Ghana College for Emergency Medicine, and then the senior specialist at Confano Teaching Hospital, Accident and Emergency.
I'm Gayoni Bolo Solomon. I work as the Chief Executive for the Ghana Red Cross Society.
Oh, okay.
Yes, I have worked with National Ambulance through the regions. He's my regional minister. Okay, how will I say it? He's from BA. I used to work in the old BA.
I see.
Yes, and I have been brought to the head office now.
Oh, that's good.
Yes, thank you very much, sir.
Thank you too.
As introduced, my name is Solomon Namidwa. Former N, and I remember.
My name is Abu Ramadan, not more Deputy Director General in charge of operations.
Michael Dumonso. I'm the Principal Advanced Emergency Medical Technician for the National Ambulance Service.
Thank you, Honorable. My name is ACP Dr. Samuel Ofori, the Ghana Police Service. I'm a fellow at West Africa College of Surgeons and Ghana College of Surgeons. I'm an orthopedic and trauma surgeon.
I am Colonel Gordon Alexis Sobriapia. I'm a neurosurgeon. Currently the Deputy Director General, Ghana Armed Forces Medical Services. Thank you, sir.
Thank you.
Thank you, Honorable Minister. My name is Dr. Mario Nokonwusu. So briefly, I have worked as a professional medical doctor for the past 17 years, 11 years of which I've been in senior management with the ministry and the Ghana Health Service. I've worked at Mpopo, Elembele district, and have keen interest in community health systems. And so I thank God for this opportunity to work on the first board of the National Ambulance Service and hope to do my very best. Thank you.
But you didn't tell us where you are now.
Okay.
I'm interested in.
Please, presently I'm at Sehubodi
As
the Regional Director of Health Services. I'm a public health specialist. I'm a member of the Ghana College of Vision and Studies. I also have a PhD in health policy. Thank you.
Thank you, Honorable Minister. I'm Dr. Eric Nsiamboatin, Head Monitoring and Evaluation of the Ministry of Health. Before assuming this position, I worked at the National Health Insurance Authority for about 17 years now. I have a PhD in public health, but I'm so much interested in health system research. Thank you.
For this occasion, we will now go to the actual thing that brought us here, the inauguration. It's like a ritual. So we are going to take oaths two of them, the official oath and the oath of secrecy. I believe you have copies of these oaths. I say that.
Do solemnly affirm that
I will faithfully and conscientiously perform my duties as a board member of the National Ambulance Service in accordance with the provisions of the National Ambulance Service Act 2020, Act 1041. I will also support the other members of the board to ensure the achievement. Affirm that.
do solemnly affirm that
I will not directly or indirectly communicate
which shall come to my knowledge
in the discharge of my official duties.
limited by law.
So help me God.
So help me God.
I thank you and congratulations. We will collect them after you have finished. Newly appointed members of the governing board of the National Ambulance Service. Let me, on behalf of the President and myself, congratulate you upon your nomination to serve on the National Ambulance Service Board. The service, as you're all aware, is a statutory agency of the Ministry of Health, established by the National Ambulance Service Act 2020, Act 1041, which has the mandate to provide effective and efficient administration and management of emergency care services and to provide for related matters. Under the Act, this board has the duty as having fiduciary relationship with the service and the same duty to act with loyalty and in good faith as a director of a company incorporated under the Companies Act 2019, Act 992. A member has the duty to act honestly in the performance of the functions of that member, exercise the degree of care and diligence in the performance of the functions, avoid making improper use of information acquired by virtue of the position of that member, so as to benefit that member or detrimental to the service, and not to abuse the position of the office. And abuse comes in several different forms. At your level, you all know what it constitutes. The National Ambulance Service, since its inception, has chalked numerous successes over the years. The service migrated from 7 stations, that was in 2004, I presume, in only 3 regions, to the current presence in all the 216 districts of our country. And that is a very huge achievement. Distinguished ladies and gentlemen, despite the successes of the service, there remains numerous operational challenges. Lack of logistics and funding, inadequate human resources, among other things. You'll agree with me that amidst the current COVID-19 pandemic and other public health emergencies, pre-hospital care has become more important than ever. And pre-hospital care is an essential part of the continuum of emergency health care. I have no doubt that with the caliber of personalities on this board, you will live up to our expectation. It's expected of this board to support management of the service and the ministry to devise strategies to mobilize resources, both human and financial, to ensure the effective operations of the service. And it is only when these resources supplied are adequate that the service can deliver efficiently and effectively on its mandate. And I believe together we will work to see how we can mobilize resources for the efficient and effective work of the service. It is also worth noting that members of the board come from diverse backgrounds, including government agencies, security services, and civil society organizations. This makes a classic case for effective intersectoral collaboration to maximize the achievement of the mandate of the service. Big role that you can also do networking within your system to also support the efficient operations of the service. So all of you sitting here, everybody has a role to play. We have a former MP, the doctors, the police people, the military, the Ghana Health Service person, and then we have Nananom also represented on this particular board. This is phenomenal. You know, when it comes to stakeholder engagement with the communities and the chiefs, we also have somebody who will lead us. You know, and the ministry has given you potential. What you are young, but you have a white beard, so I don't know whether to call you a young man. You know, somebody who collates and put together reports and research into the type of work you do to report back to the ministry. So I thank you all very much for coming and accepting the present nomination of you to come and sit on this board. And on this note, I singularly will pronounce the National Ambulance Service Governing Board duly inaugurated. I thank you very much.
And so,
If you do that, the military man will also take. Colonel, don't mind them for me.
thank you very much, Honorable Minister. And so we invite the EMTC.
All EMTs in uniform secret, join us on stage. All EMTs secret, join us on stage. Join us.
Deputy Ministers and Directors, members of the Constituted Board of the National Ambulance Service, representatives from the media, ladies and gentlemen, I'm privileged to be here today on this memorable occasion of the inauguration of the very first National Ambulance Service Governing Board, and as its chairman. With your kind permission, I would like to proceed to share a few remarks. To start with, I would like to thank the President of the Republic of Ghana, His Excellency Nana Addo Dankwa Akufo-Addo, and the Honorable Minister of Health, Honorable